So thank you, Aris, and thank you all the organizers of the conference for having me at this conference. Indeed, as Aris just recalled, we had already a very rich session yesterday, both morning and afternoon, with what I found very insightful and thought-provoking presentations by many of you. So today, I will try to not repeat too much what has been already said, and what I'm going to bring today is mostly the public finances perspective, and more specifically, how the aging of the population is going to impact the pension and the healthcare system, so the public finance through the pension and the healthcare system, and how we can indeed redesign, rethink of them. Now, coming from the European Commission, will be no surprise to any of you that the focus of my presentation will be on European Union countries. So, to start with, well, of course, aging of the population is a global phenomenon. I think that many of you are familiar with this chart. If we look at the fertility rates, they've been globally declining, and actually they have gone below the so-called replacement level, even for countries like China and India. Yet it remains true that European countries are further, much more advanced in terms of aging. In fact, if we look at this second chart, which compares the median age of countries, how it is now, actually the latest available data are from 2022, but does not make a huge difference, and how they are projected to be in 5 decades from now, we can see that the yellow squares, which are indeed the European countries, are already much older and are projected to become older than comparatively to other countries. So if I zoom in indeed on European countries, and in particular on the composition of the population, how it is projected by Eurostat through the Europop projections. And I have heard what Andrew said yesterday, that we should not focus so much on composition, but I still maintain that when it comes to public finances, composition is something that we need to take care of, at least we need to pay attention. Here, basically, the main message that I would want to pass is that, especially when we look at the projections in the next 2 decades, and then if we jump up to 2070, what we can see is that what started as a gradual shift in the composition is going to become faster and faster. Already in 2045, we are projected in terms of European population to lose 20 million people in the working age, and 10 million, we will have 10 million people less among the youngest, but where the change in the composition becomes dramatic if we look at the projections in 2070, where while the overall population, and I should have mentioned here that these numbers from Europop are inclusive of the effect of net migration, so these figures include the effect of net migration. So as I was saying, in 2070, while the global numbers are equal to what they were in 2000, the composition, as you can see, is very, very different. In total, we are going to have 65 million people less of people below 65 years old, and 64 million more among the oldest, and especially a huge shift in the number of people above 80 years old. So why, this change in the composition is important, and here I think I can go relatively fast. Well, first of all, because older population behaves differently, everything else equal. So let's say, in a scenario of unchanged policy, older population means, in principle, fewer hours worked, and therefore, in absence of any productivity gains, less growth. We have heard yesterday a lot of things about saving. Of course, there will be precautionary saving from working age population, but it's also true that older people are known to themselves to save less, and then clearly different consumption pattern, different housing preferences. But what is relevant in terms of public finances is especially that older population will have different needs in terms of demand for personal assistance, demand for healthcare services, demand for long-term care, and the other very relevant dimension, at least from a public finance perspective, is that older population will put pressure on the pension system, especially on the pay-as-you-go system as we know them, because basically we will have more years spent in retirement with fewer people contributing to the sustainability of the system. So this overall is an issue for the sustainability perspective, and it's something that actually we need to monitor. Now, before moving to the specific of the pension and the system, I just wanted to show basically the projections that we have from the aging report that we published. I mean, it's a joint report between the European Commission and the Economic and Policy Committee of the Council, which is published every 3 years, and this is the latest that we have published 1 year ago, actually. And this depicts our projection from what we call the cost of aging between now and 2070, and with the breakdown by the main contributors to the cost of aging, which are the pension system, the health care, the long-term care, and the education. And as you can see, basically, for most of the European countries, the cost of aging is projected to significantly increase between now and 2070, with an average projected increase of 1.2 percentage of GDP, which is massive, considering where we are starting from. Where what you can see is that the main driver of the cost of aging comes from the pension system, from the public spending in pension, although basically there the pattern is heterogeneous. So in many countries, we still project the public spending in pension to increase between now and 2070, although there are also a number of countries where these costs are projected to decrease, and this is on the back of successful pension reforms that have been legislated and enforced over the past years. Conversely, when we look at both the healthcare and the long-term care public spending, we can see that basically there the increase in public spending is something that will happen across the board. So all the countries are projected to experience an increase in public spending, both in healthcare and both in long-term care. I will say just a few words, is not really the focus of my presentation on education. Of course, having fewer younger people means, from the perspective of public spending, less public spending in education. I would just pass the message that, of course, less public spending in education may have some unwarranted and unwelcome consequences for our society. So it could be a good thing in the short term for public finance, but not something that we should be happy about. Now, I'm going now to focus first on the pensions and looking a bit more in detail in what is the breakdown of the public spending in pensions. So the main factor that is present in all the countries is what we call the demographic factor. Is the factor that comes from the aging of the population itself, is the dependency ratio. So in all countries, most of the projected increase in public spending actually comes from demography itself, from the fact that we will have a different composition, more older people and less people in the working age. And this demographic factor is something that actually, and I think there, the literature is quite consistent in the findings. The demographic factor is something that is largely beyond the policy control, largely beyond what a policymaker can really influence. Now, the good news is that there are other factors that are under the control of the policymakers. So the first one is the coverage ratio, which actually measures effectively how many people above 16 years old are effectively receiving a pension. And this is something that is under the control of the policy action of the policymaker, because this is something that depends on how we design the pension system. For instance, the fact that in many countries, as you can see, we expect basically this to contribute to savings in terms of public spending is related to the fact that there are a number of reforms that have legislated stricter requirements to access the pension system. So this is something that actually can offset, if not offset, at least compensate the increase due to the demographic factor. And likewise, a second factor, which is the benefit ratio effect, which actually is a sort of a measure of the generosity of the system, is also something that is under the control of the policymaker, because basically through indexation system of the pensions, this can again offset the demographic factor. Now, without going in the details of all the other factors which have, let's say, a residual importance, here, perhaps the main message I would want to pass is that, indeed, as you can see, in many countries, pensions spending, public spending in pensions is projected to be increased, but is a dynamic which we can control, and is in the middle of the chart. I hope that you can see it. I think quite very interesting is the case of Austria, which is really in the middle of the chart, where you can see that while the demographic factor related to the aging of the population is very relevant, basically the policy actions taken, I mean, there have been a couple of reforms enacted in Austria to harmonize the retirement and the effective retirement age between women and men, and to introduce an indexation of the system, totally offset the demographic factor. So you can see that basically from now to 2070, in the next 5 decades, despite aging of the population, at least according to our projections, the public spending in the pension system in Austria would remain muted, because there are these offsetting forces behind it. Now, when we look at the situation, the current situation in terms of access to pension, to the statutory retirement age, we see that currently most of the European countries have a retirement age which is between 65 and 67 years old, although there are still several countries that are below 65. This is projected according to what are the already adopted and legislated reforms, even if they will enter in force only in the coming years. This is going to change already in the next 2 decades, where you can see that basically all the countries will have a minimum retirement age as from 65 and above, and is projected to move still further in 2070. This is because, in fact, many, I mean, at least 10 member states in the European Union have adopted reforms that link the retirement age to life expectancy. So this is one of the is one of the automatic adjustment mechanism that is something that we usually recommend in what are known, in the, at least in the Brussels jargon, as a country-specific recommendation that are issued every June to member states, to have indeed an automatic adjustment mechanism. And this is one that we consider particularly successful, an automatic link between the life expectancy and the retirement age. As you can see in this table, there are also other automatic adjustment mechanisms. Another one, which is the one in the second column, which has been adopted also in several countries, is actually to link to the life expectancy the benefit system. I have to say that this is not among our favorite one, at least from the European Commission perspective, because it's something that can hamper the adequacy of the system quite significantly, because basically, rather than accumulating earnings for the pension system, it's as could have the effect of reducing the benefit. So it's something that we do not really like. And likewise, also, any mechanism that automatically introduces a balancing system is not necessarily the most adequate, at least in terms of adequacy of the system. The other thing that I want to show is that one other thing that we need to consider when we look at how to redesign the pension system is the fact that in many countries, still today, the effective age to get in retirement is lower than the statutory retirement age. And why it is so? Because in many countries, there are still what we call early retirement schemes. And second, there are also a lot of special retirement schemes that very often are an inheritance of the past, We believe that both early retirement schemes and special retirement schemes, especially when they are not really justified by the current condition of the labor market, are very good candidates for redesigning the pension system and to be reformed. Now, one other thing that we do in our aging report is to consider what would happen under a number of alternative policy scenarios. So what I've been showing so far are the baseline scenarios, so scenario of what are the expected costs in the pension system at unchanged policy, so basically just enacting the reforms as they are now. But we have at least 3 alternative policy scenarios. The first one is a scenario where we assume that basically the gains in life expectancy are translated in a higher age to get retired with a factor of 3/4. And basically, according to this scenario, you can see that basically all the countries would have very significant saving in their public funded pension system. And just in case you wonder how comes that a few countries would not have a gain, is because those countries have this system already in place, so there is little to gain further. But otherwise, for all the other countries, linking the retirement age, the effective retirement age, to the life expectancy has the potential to really help, at least from a public finance perspective. A second scenario, which actually has an opposite message, is a scenario where we assume what would happen if the retirement age would be frozen at the level as it was in 2024, so when we published the report. So basically, this is a sort of a policy risk scenario where we assume that although there have been reforms and they have been legislated and adopted, they would either not be enforced, or even worse, and is something which unfortunately we are seeing in some of our countries, they are reversed because, it is known that pension reforms stay quite at bottom of the popularity of structural reforms. So in a scenario where the reforms would either not be implemented or even reversed, basically we see that conversely the cost of aging related to the pension system is projected to increase, and to increase quite a lot. And third policy scenario is a policy scenario that looks at the adequacy of the system. So here what we do, we assume that basically if the benefit ratio drops by more than 10 percentage points, the policymakers would intervene to prevent the adequacy of the system to fall further. And again, in this scenario, of course, the cost of the pensions, the public cost of pensions are expected to increase, and to increase significantly. Here the main message is that, as I'm going to say in the next slide, that when we think of how to redesign the pension system, we need actually to keep 3 dimensions in mind. We believe the sustainability of the public finance, which is actually the angle where I'm coming from, but at the same time the financial adequacy of the system and the social fairness. And in terms of reforming the system, we believe that there are a few basic principles that should be followed. Of course, this is not a silver bullet, it's not the solution for everything, it's just ideas that I'm throwing. Of course, there is the basic principle that working more or longer should lead to higher pension rights, so indeed to establish a link between earnings and benefits. As I said before, any deviation from general rules, so early retirement schemes, special schemes, needs really to be reduced and well justified. Also because one aspect to be kept in mind is that the moment that one tries to implement a pension reform, keeping alive schemes from the past that basically are related to well-gone working condition actually hampers also the legitimacy of any pension reform that one would propose. Third aspect, which we believe is important, is to shift the mindset in the sense that we believe that we should not think anymore that people of the same age are equally old and equally unfit to work. We need basically to change our mindset and start thinking in terms of not only of life expectancy, which of course is important, but also career length. This is because current and future cohorts are expected to be more educated, which means with all likelihood that they will enter the labor market most likely later, but they have also the potential to stay longer, so to compensate less educated cohorts. And then reforms need to be introduced gradually to avoid cliff effects, especially between similar cohorts, widely supported and predictable. This is why basically we recommend very often to have changes that are automatic, because to enhance predictability. I'm not going to dwell on the other aspects. We have heard already yesterday morning the importance of supplementary pension schemes. This is something indeed that needs to be looked at. And again, I will not go in any of the flanking policies, also because I believe that many of the speakers after me will cover the flanking policies in other area. So let me move then on healthcare and long-term care, which are the other two main drivers behind aging costs. So to start with the healthcare. Now, when we look at the relationship between the age of individuals and their use of healthcare, this is actually well displayed in this curve, which is the so-called age-related expenditure profile. What this chart tells us is that indeed the costs are, first of all, high in the very young age, then they become relatively high for women around the maternity age, but it is after the 50 years that basically the curve goes significantly high, which means that having an aging population will mean a greater proportion of population being in the more expensive categories. And actually, when we look at the determinants of the public healthcare spending, there are many factors. Of course, the population itself, the aging of the population, the structure of the population is the main factor, as shown in the previous chart. But there are many other factors, and I won't have the time to go in each of them, but just to give you a snapshot, an overview, we have factors on the demand side and factors on the supply side. On the demand side, as I will explain in a moment, the one thing, and we have already heard about it somehow already yesterday, the health status of the population is something that is going really to make a difference in terms of healthcare cost, the income, also the climate change. It's known that heat waves, of course, affect the oldest part of the population in a different way, so it's something that also will enter in the overall picture. And on the supply side, as we will see in a moment, the institutional setting, the availability of healthcare systems, the distance of these systems, the workforce presence, and actually, as I will say in a moment, the shortage of a workforce in the medical area is something that is being problematic. And then, of course, the technological developments, both in prevention, diagnostic, and treatment, are also things that will affect the spending in healthcare. Now, in the interest of the time, let me move here. So, first of all, at unchanged policies, we see that the public spending in healthcare is projected to increase by almost 10% between now and 2017 in the European Union, in the European countries. But what is interesting is that actually it will make a huge difference if the aging of the population, as we have heard yesterday, will happen under healthy or non-healthy condition. So basically here in this scenario, what we call a no healthy aging scenario is a scenario where we assume that all the years gained in terms of life expectancy will be spent in some morbosity condition, while conversely, the health aging scenario assumes that all the years gained in terms of life expectancy will be healthy years. And here you can see that actually a healthy aging scenario has the potential to actually contain or at least maintain the aging cost almost stable. So building on what was said yesterday, of course, it's very important that longevity is healthy longevity for all the reasons that we have heard yesterday, but also because it's important from a public finance perspective. So this is the first message. The second one is that actually, while under the baseline, health costs are projected to increase by 10%, the increase could be much higher and worse in what we call a risk scenario, which actually projects past pattern in terms of both workforce and technological developments. Here, perhaps a word of caution. I'm not saying that basically the pattern of the past will replicate necessarily in the future, but what is true is that what we are seeing in terms of technological developments for both prevention, diagnostic, treatment, although cost-effective, is still very expensive. All the innovations that we are seeing are still very, very expensive. So from a perspective of public finances, they are going to wait on public finances. And as I will say in a moment, also the shortage in the workforce is something that needs to be actually taken care of. So based on this, what we normally recommend in terms of redesigning the healthcare system, well, first of all, here, I can just repeat what has been said very strongly yesterday, that health prevention is key for all the reasons we have heard, and also because it will have the potential to decrease the public spending in health. So really a strong message to both basically institutions, but also citizens, that is important to focus on prevention. And there we actually see that there is still a lot to be done, at least in the European countries. Really, it requires quite a strong shift in the mentality to move towards prevention. And then when we look more at the institutional side, integration of healthcare, one of our most frequent recommendations is a rebalancing from the hospitalization to primary care. It's really important that the primary care level acts as a gatekeeper to diagnosis in early stage any morbosity status. So this also has the potential to help, at least from a public finance. As I was saying before, address staff shortages. I don't know if this will be covered in any of the successive presentation, but we believe that this is something that actually is really important to address, because we see that in many European countries, in the medical sector, in the healthcare sector, there are quite huge staff shortages. And there, basically, there is a clear negative impact, of course, because this creates long waiting time, it delays the moment of the diagnosis. So basically, in the medium term, it increases possibly the cost, because people are diagnosed and enter in the healthcare system at a later stage than if we would have more GP. At the same time, solutions like incentivize the medical profession through higher salary would not be a solution, at least from a public finance perspective. So here, actually, I leave you with the question and without a solution. And also, it is, based on our knowledge, also very unclear how much AI can really help when it comes to the medical profession. And then, of course, as I say, the digital solution and integrating the impact on health status on all our policies. Very briefly, I'm approaching the end of my time. When it comes to long-term care spending, again, baseline projections, the cost will be increasing between now and 2017. Here, when it comes to long-term care, one aspect that needs to really to be considered is that there is also an interesting socio-economic effect, because with the higher, which is a very positive development, with the higher participation of women in the labor market and with the higher labor mobility, the fact that still many European countries rely a lot on family-based informal long-term care is going necessarily to change. And similarly to the healthcare, also for the long-term care, it will make a difference if the additional years in terms of life expectancy will be spent in a condition of disability or without disability. So again, is the same message as for the healthcare. And second message is that, as I said, at least in the European countries, currently the situation is very heterogeneous. We have only a few countries with universal system. Many countries have basically minimalistic services when it comes to long-term care, and still many countries have just informal system. Now, if we consider a policy scenario where all the countries would converge to a EU average in terms of probability to receive a long-term care assistance, so in terms of both coverage and costs, which again are very positive developments that we aim at. In terms of costs and impact on public finances, this is going to be huge. It's going to be almost 3 times higher than it is now. So in terms of redesigning, in terms of reforms, one thing that we believe is really important is to establish a clear system to assign every care recipient to the appropriate level of care provider. Not everyone has to go to an institution. There can be home care, although it in a formalized way, it can be cash benefit. So it's important to establish an appropriate correspondence between care setting and care recipient. We see a lot of fragmentation in the way European countries provide long-term care. This has also to be addressed, and perhaps mostly, let's say, from analytical perspective, one thing that we are struggling a lot is that when it comes to long-term care, basically the data are of very low quality, very heterogeneous. So basically, I mean, there is also a lot of work in terms of data availability. So a few conclusions. Indeed, public expenditure on pension, health, and long-term care will put pressure on public finances. This needs to be addressed because will be not the only needs to be addressed. We have the green transition, we have defense, so there will be a lot of competing needs to be addressed. And this is why reforms are important. I didn't have the time to enter into it, but I believe that also the intergenerational fairness is something that we need to consider. And perhaps just as a few words, when it comes to reforms, beside the pension reforms that are a story of themselves, with the Next Generation EU and the Recovery Resilience Facility that were triggered with the biggest health crisis that we have been having over the past years, we have actually the potential to boost reforms in the member states. Currently, when just focusing on healthcare and long-term care under the Next Generation EU in the European countries, there are 120 reforms in the healthcare and the long-term care system that are being enacted. So this is a success story and something to be happy about. And with this, I thank you for your attention.
Thank you very much, Angela. Perhaps we should take some questions if there is someone from the audience. Professor Tinios. And please give us your name.
It's an observation or perhaps a clarification. What you mentioned are the public costs for longevity. That means in a very large number of countries, these come up after a significant retrenchment of public expenditure, or for example, pensions. I mean, these, especially in Greece, that comes after some rather radical reforms. Now, this seems to me creates a gap for the private sector. I mean, it's essentially, it's a call for the private sector to step up. And my question is, are there any levers to work out or to track whether the private and occupational sector is actually responding, or is it really just wishful thinking?
Okay, I start replying to this one. Yes, no, you are totally right that there is a potential for the private sector. Actually, I did not have the time, but basically it's something that we also recommend a rebalancing between what we call the first pillar, the second and the third pillar of the pension system. If there is a potential there, definitely yes. We have already some cases where basically auto-enrollment under the second, third pillar, under private system are becoming sort of indeed automatic or mandatory coverage for these different pillars. So there are a number of avenues that can be indeed exploited. And then, of course, there are all the other questions that were somehow addressed, I mean, at least asked already yesterday. I mean, all these saving and contribution that will go through private funds. Of course, there is also a question where to channel. I mean, of course, there is an important role when it comes to the income replacement function, so in terms of the pension system itself, but one of the questions that we are asking ourselves in Brussels is all this money and saving, I mean, how could also contribute to boost the growth and the investment capacity of Europe. But yeah, you're very right.
Okay. Now, Professor Tsakloglu, the former Deputy Minister for our pension scheme. You are responsible for the reform, okay, so you have to
Okay, thank
apologize.
Thank you for your kind words. First of all, thank you very much for the very nice presentation. In the Pensions Party, you were arguing, and actually there are several voices in favor of this idea of focusing more on career length rather than time of retirement. This can be explosive. If we are otherwise identical, but we both work for 40 years, for instance, I started 20, you started 30, this means that if we respect this rule, I will have 10 more years of pensions. If we do not take any measure there, the cost will be enormous, the additional cost. Do you argue for equal pensions for equal number of years of employment and contributions, or this proposal contains also some kind of the adjustment of the level of the pension?
No, thanks for the question and also for giving me the opportunity to clarify. So basically, everything that I was talking about and showing is a sort of a basket. As I said, we don't have the silver bullet. It's just that basically are the different dimensions of our thinking. And we believe that actually, as I said, a link to life expectancy is crucial, is probably the basic principle, but at the same time, it is a fact that basically the job market, the labor market is changing, that people are more educated, have the potential, I mean, they will enter probably, as I said, later have the potential to stay more, and probably they are happy to stay more. So it's just a dimension to be thought about. I'm not in any way saying that this is the 100% solution or way to go.
Thanks. So very interesting presentation. So one thing that I think is containing the rise in the pension and the GDP ratios in a lot of these projections is assumptions on productivity growth, because a lot of the pensions are indexed to prices, not wages. And so are you concerned about the future of productivity growth when you do these projections? And I know there's some robustness, you know, and typically there's done relative to productivity assumptions, but are you concerned about that? And also, are there ways to de-link these by doing reforms to remove the dependency on productivity growth?
No, in fact, the baseline projections are done under the assumptions that there are no productivity gains. So basically, in our model, we have our TFP projections, but without basically factoring in any impact from innovation, developments. So this would actually be a sort of different scenario, and clearly, I mean, with some positive looping effect, but it's not what is reflected in our policy, no policy change projections. It's without any assumptions in terms of productivity gains. Yeah.
Okay, Professor Scott. And
thank you. Another great outline. I guess I've got a couple of things. One will perhaps link into the next panel. You're looking here at how we stabilize the public finances, which of course is incredibly important. But I think from that 2 points I thought, one was, it was striking to see how many countries are linking the retirement age to life expectancy. And I think that's wrong for all sorts of reasons. And I think it should be healthy life expectancy. And I think that's going to be a really big political challenge if we just keep raising the retirement age linked to life expectancy, let alone all the distributional issues. The other thing which I think just, I do the same thing myself, you showed the increase in health costs that will come from aging. And so if we can age better, we can spend less. I do sort of think governments are going to have to start thinking, if we spend more, we can get people healthy. And that in itself is going to be incredibly important. So I think there's going to be a real tension there in how we think about the health systems. I think to some degree, treasuries think that spending money on disease and care is a dead weight loss. Whereas I think if you can keep people, if you can compress morbidity, it's an incredible welfare gain. And I don't know how that issue gets raised up the ministries of finance, because making us healthy is incredibly important. It's the most important aspect of an aging society. So it's more of a comment than a question. But,
Okay. Accelerate a bit.
Even though this approach that you mentioned before about healthy living is absolutely, from a theoretical perspective, is correct, in practical terms it is impossible to do. Life expectancy is something that we measure. Healthy life expectancy is something that depends on the model that you use. There is an equivalent in macroeconomics. In macroeconomics in the European Union, we have this rule of 3%, etc., etc., and also for the deficits and so on. We all know that the correct measure is the to look at the cyclically adjusted structural deficit. However, this is something that is model-based. This is not something that you observe in the national accounts. Therefore, it is extremely difficult. Even though theoretically it is very appealing, in practice it is extremely difficult to implement.
Very live discussion, but we have, okay, 2 more questions and we stop it because we run out of time. Phyllis, and then...
Yeah, my question was very related to what Andrew just mentioned. It was also more about a communication strategy for what we are trying to achieve. Because, when you do the pension reform, it's always linked to fiscal tightening, consolidation, that type of discussion, and therefore it brings a bit of a negative stigma to the public discussion on that as well. And as Andrew mentioned, maybe that we need to spend first, increase the public spending for longevity, for prevention, and then start thinking about increasing the retirement age or broader pension reforms. So, is there a thinking in terms of maybe this should be presented as more of a medium-term package on aging and longevity, that certain policies could be sequenced depending on country-specific circumstances, but in certain cases you may need to increase spending first. Yeah.
Thank you, Felix, for the question. And actually, this is one of the reasons, I could not develop more why I wanted to, finish my concluding remarks with the very positive experience of Next Generation EU and the Recovery and the Resilience Facility, because this is indeed, as I said, we have 120 reforms on the health system and the long-term care system being enacted. And in terms also of communication, one of the messages we passed, which was a shift from the usual way money from Brussels are seen, the message that we passed with the Next Generation EU is, yes, you will have money, yes, it will be important to build a new hospital, but before building a new hospital, it's even more important that you reform the way healthcare systems are provided to citizens. So there is actually, this mentality is something that has taken shape over the past years, and we are doing a huge communication effort. As I said, pension system is more really on the realm of the traditional public finances. It's something that actually we are discussing with the countries, not really under the Recovery and Resilience Facility, with some, yes, but not all of them, but mostly with the under the new governance system with the medium-term fiscal structural plans, of course, is something that we are saying, okay, in case you do a pension reform, you could have a more gradual adjustment in terms of consolidation. You can move from the 4 years to the 7 years. So it's something that, yeah, we are also passing the message to the countries.
Okay, and the last one, please, because we are out of time. Please.
I just wanted to ask you if you or anybody at your directorate is dealing with insurance companies related to long-term care. Because insurance companies are rather discriminatory of age. In other words, they don't want to work with people over 65 or 70, and they are not very happy. As Professor Scott mentions in his book, there are tools that insurance companies can find to deal with issues of covering long-term care. Do you have any answer on that? Oh, I'm sorry. Hello?
To be totally honest, is not something that the department where I'm coming from follows in terms of insurance schemes, but there are other parts in the European Commission that look at the insurance system as well, but I would not be able to give a proper and direct answer to your question.
Thank you very much, Angela, and sorry for we ran out of time and we have over our program here. Thank you very much.